Once an ACO starts the APP reporting process, how much time is required for member practice communication and education regarding the requirements for the APP?
We certainly see a lot of variation in how much training and support each ACO gives its practices. Adequate training and support pays off with better performance scores. To start with, a good hour with a knowledgeable resource should give an adequate understanding of the basics, although to generate accurate and great metrics requires a deeper knowledge that goes beyond the understanding of the specifications. Numerator to denominator specs of each measure is a good starting point. Understanding the documentation workflows and variation in those workflows is important. Cataloging the location in your specific system of the data you need is required. The access rights and skill to locate the data and transmit what is wanted and needed is also important. There can be both business and security barriers to access the data, and there are factors controlled by entities outside of your practice, including the EHR vendor, the data host, and other intermediaries. Knowing who to ask and how to get access permission and credentials may be more difficult than acquiring the tools and skills to access it and extract it. I think you're in the right ballpark to devote an hour monthly to focus on training, education, and problem solving of your system. I like group processes where everyone meets at once. Everyone hears the same thing at the same time. Questions are asked that everybody needs to know, but only one person thought to ask. Important lessons are shared about how practices get access to their data. Often practices in a group in an region, though on separate instances of EHR, are using the same EHR. And as they find out who to ask to get access, they can share that with everyone else and learn and spread that advantage. You will develop your own shared support as your group gets to know each other and get comfortable asking for help and helping each other. You'll find that cross fertilization to be quite effective. Um, and varies from practice to practice how much the ACO provides and how much Mingle Health provides. You can certainly ask us for more support. The best process is always one where the burden is shared. Where you have the local support that comes back to the expert for expert guidance and help. So that monthly hour is the time you're learning together, but then there'll be additional time that individuals use to do the work, and that again will vary with the complexity of the data you're extracting or abstracting, and the skills of those people doing it. And I won't hazard a guess of what that time commitment will be.